Question 1. The risk matrix shows a moderate potential for patient anxiety when discussing the impact of various therapeutic interventions on early embryonic development. A pregnant patient expresses concern about the safety of a prescribed herbal supplement, asking for specific details on how it might affect the formation of her developing fetus. Which of the following responses best addresses the patient's concern while adhering to professional standards? Option A. Detail hypothetical scenarios of how the chemical compounds in the herbal supplement could theoretically interfere with specific cellular differentiation processes during critical embryonic periods, emphasizing the unknown risks. Option B. Advise the patient to immediately discontinue the herbal supplement and consult with a conventional medical doctor, as naturopathic physicians are not qualified to assess risks to embryonic development. Option C. Reassure the patient that all naturopathic treatments are rigorously tested for safety in pregnancy and that there is no need for further concern regarding the herbal supplement. Option D. Explain the general stages of embryonic development, including gastrulation and neurulation, and discuss how the body's intricate processes are generally resilient, while also stating that specific, definitive links between this particular herbal supplement and any particular embryological anomaly are not established in current scientific literature. Correct answer is D. Explain the general stages of embryonic development, including gastrulation and neurulation, and discuss how the body's intricate processes are generally resilient, while also stating that specific, definitive links between this particular herbal supplement and any particular embryological anomaly are not established in current scientific literature. Explanation. This scenario presents a professional challenge because a naturopathic physician must integrate their understanding of embryology with the ethical and legal obligations of patient care, particularly when discussing potential risks associated with treatments. The physician needs to provide accurate, understandable information without causing undue alarm or making definitive pronouncements about causality that are beyond the scope of current scientific understanding or their professional purview. The correct approach represents best professional practice because it prioritizes informed consent and patient autonomy. By acknowledging the patient's concern, providing a balanced overview of embryological development, and clearly stating the limitations of current knowledge regarding specific treatment-embryo interactions, the physician upholds their duty to educate. This approach avoids speculation, focuses on established scientific principles, and empowers the patient to make informed decisions based on available evidence and their own values. It aligns with the ethical principle of beneficence, acting in the patient's best interest by providing accurate information and non-maleficence, avoiding harm by not making unsubstantiated claims. An incorrect approach that focuses solely on reassuring the patient without providing any relevant embryological context fails to adequately inform the patient and may dismiss their legitimate concerns. This could be seen as a failure in the duty to educate and could lead to a lack of informed consent. Another incorrect approach that attempts to definitively link a specific naturopathic treatment to a potential embryological anomaly without robust scientific evidence is ethically problematic and potentially harmful. It oversteps the bounds of professional expertise and could lead to unnecessary anxiety or misguided decisions by the patient. Such an approach could violate principles of honesty and accuracy in patient communication. The professional decision-making process for similar situations should involve 1. Actively listening to and validating the patient's concerns. 2. Accessing and recalling relevant scientific knowledge, in this case, embryological development. 3. Clearly communicating established scientific facts while acknowledging areas of uncertainty or limited research. 4. Avoiding definitive causal statements unless strongly supported by evidence. 5. Focusing on providing information that supports informed decision-making rather than dictating a course of action. 6. Adhering to ethical guidelines regarding patient communication and informed consent. Question 2. Market research demonstrates that patients frequently present with symptoms related to the integumentary system and musculoskeletal complaints. A naturopathic physician must accurately differentiate between the primary roles of the body's fundamental tissue types to effectively address these conditions. Considering the typical functions of epithelial and connective tissues, which of the following statements best distinguishes their primary roles in the human body? Option A. Epithelial tissue's main function is energy storage and insulation, while connective tissue is primarily involved in protection and communication. Option B. Epithelial tissue is mainly for nutrient absorption and waste filtration, while connective tissue's principal role is muscle contraction and nerve impulse transmission. Option C. Epithelial tissue primarily covers surfaces, lines cavities, and forms glands, while connective tissue provides support, binds tissues, and facilitates transport. Option D. Epithelial tissue is primarily responsible for structural support and movement, while connective tissue's main role is secretion and absorption. The correct answer is C. Epithelial tissue primarily covers surfaces, lines cavities, and forms glands, while connective tissue provides support, binds tissues, and facilitates transport. Explanation: scenario analysis. This scenario presents a professional challenge for a naturopathic physician by requiring them to differentiate between the primary functions of two distinct tissue types, epithelial and connective tissue, in the context of patient care. Accurate understanding of these fundamental biological concepts is crucial for developing effective treatment plans, interpreting diagnostic findings, and communicating with patients about their health. Misunderstanding these basic tissue functions could lead to inappropriate therapeutic interventions or a failure to address the underlying pathology effectively. Correct approach analysis. The correct approach accurately identifies that epithelial tissue is primarily involved in covering surfaces, lining cavities, and forming glands, playing roles in protection, secretion, absorption, and filtration. Connective tissue, conversely, provides support, binds other tissues together, protects organs, and stores energy. This distinction is vital for a naturopathic physician when considering conditions affecting skin, epithelial, musculoskeletal issues, connective, or gastrointestinal health, epithelial lining, and underlying connective tissue. For instance, a physician might recommend topical applications for skin conditions, epithelial function, or nutritional support for bone health, connective tissue function. This aligns with the NPLEX exam's focus on foundational biomedical sciences necessary for safe and effective naturopathic practice. Incorrect approaches analysis. One incorrect approach might conflate the primary roles, suggesting epithelial tissue is mainly for structural support. This is a failure to adhere to the fundamental definitions of tissue types, as structural support is a hallmark of connective tissue. Ethically and regulatorily, this demonstrates a lack of foundational knowledge, which could lead to misdiagnosis or ineffective treatment, potentially harming the patient and violating standards of care. Another incorrect approach could propose that connective tissue's primary function is secretion. While some connective tissues have specialized cells that secrete substances, e.g., osteoblasts secreting bone matrix, secretion is the defining characteristic of epithelial glandular tissue, not the primary role of connective tissue as a whole. This misattribution of function indicates a superficial understanding, risking the selection of inappropriate therapies. A third incorrect approach might suggest that epithelial tissue's main role is energy storage. Energy storage, primarily in the form of adipose tissue, is a key function of certain types of connective tissue. Attributing this to epithelial tissue demonstrates a significant misunderstanding of tissue specialization and function, which could lead to flawed diagnostic reasoning and treatment strategies, failing to meet the expected standard of competence for a licensed naturopathic physician. Professional reasoning. Professionals should approach such questions by first recalling the core definitions and primary functions of the tissue types in question. They should then consider how these functions relate to common clinical presentations and the scope of naturopathic practice. When faced with uncertainty, consulting reliable, peer-reviewed scientific literature or established textbooks on histology and physiology is paramount. This systematic approach ensures that clinical decisions are grounded in accurate scientific understanding, promoting patient safety and therapeutic efficacy, in line with regulatory expectations for competent practice. Question 3. Assessment of a patient presenting with acute shortness of breath, wheezing, and a history of asthma. The naturopathic physician must consider various diagnostic and therapeutic pathways. Which of the following approaches best aligns with the regulatory framework and ethical standards for naturopathic physicians in assessing and managing this respiratory condition? Option A. Relying solely on a spirometry test performed by a technician, without integrating the results with the patient's subjective symptoms and the physician's physical examination findings. Option B. Prescribing a course of antibiotics, assuming a bacterial infection is the primary cause of the acute respiratory distress, without performing diagnostic tests to confirm the presence of a bacterial pathogen. Option C. Immediately administering a high dose of a specific herbal remedy known for bronchodilation without further diagnostic investigation, based on the patient's self-reported asthma history. Option D. Conducting a thorough patient history, performing a physical examination including auscultation of the lungs, and considering appropriate naturopathic diagnostic tools, while recognizing the need for referral if symptoms suggest a condition beyond the scope of naturopathic practice or require immediate conventional medical intervention. The correct answer is D. Conducting a thorough patient history, performing a physical examination including auscultation of the lungs, and considering appropriate naturopathic diagnostic tools while recognizing the need for referral if symptoms suggest a condition beyond the scope of naturopathic practice or require immediate conventional medical intervention. Explanation: this scenario presents a professional challenge because a naturopathic physician must differentiate between a patient's acute respiratory distress and a potential exacerbation of a chronic condition, while adhering to the scope of practice and ethical guidelines governing naturopathic medicine in the relevant jurisdiction. The physician must consider the patient's history, current symptoms, and the limitations of their diagnostic and therapeutic tools, ensuring that all interventions are within the established regulatory framework for naturopathic physicians. The correct approach represents best professional practice because it prioritizes a comprehensive and evidence-informed assessment that respects the patient's autonomy and safety. This involves a thorough history, physical examination, and consideration of appropriate diagnostic tests, all within the scope of naturopathic practice as defined by the relevant licensing board. It also includes recognizing when referral to another healthcare professional is necessary, which is a critical ethical and regulatory obligation to ensure the patient receives the most appropriate care. This aligns with the principle of do no harm and the commitment to providing competent and ethical care. An incorrect approach that relies solely on a single diagnostic modality without considering the broader clinical picture is professionally unacceptable. This could lead to misdiagnosis, delayed appropriate treatment, and potential harm to the patient. Such an approach may violate regulatory requirements for thorough patient assessment and could be considered a failure to exercise due diligence. Another incorrect approach that involves prescribing treatments outside the scope of naturopathic practice, or without adequate evidence to support their efficacy and safety for the presenting condition, is a significant regulatory and ethical failure. This could expose the patient to unnecessary risks and undermine the integrity of the profession. A further incorrect approach that dismisses the patient's subjective experience or fails to adequately investigate the underlying cause of the respiratory symptoms is also professionally unacceptable. This demonstrates a lack of patient-centered care and may violate ethical obligations to thoroughly investigate and address patient concerns. The professional decision-making process for similar situations should involve a systematic approach. 1. Gather comprehensive patient information, history of present illness, past medical history, family history, social history, review of systems and current medications. 2. Perform a thorough physical examination, focusing on the respiratory system. 3. Consider differential diagnoses based on the gathered information. 4. Determine appropriate diagnostic investigations within the scope of naturopathic practice, or refer for such investigations if outside the scope. 5. Develop a treatment plan that is evidence-informed, individualized, and within the scope of naturopathic practice. 6. Recognize the limitations of naturopathic practice and know when to refer to other healthcare professionals for further diagnosis or treatment. 7. Continuously monitor the patient's response to treatment and adjust the plan as necessary. 8. Maintain clear and accurate documentation of all assessments, diagnoses, treatments, and communications. Question 4. Comparative studies suggest that certain patterns of numbness and tingling in the extremities can indicate specific nerve compressions or neuropathies. A patient presents with progressive numbness and weakness in the distribution of the median nerve in their dominant hand, accompanied by intermittent paresthesias that worsen at night. Considering the NPLEX scope of practice for naturopathic physicians, which of the following diagnostic and management approaches best reflects professional standards? Option A. Immediately prescribe high-dose B vitamin complex and alpha-lipoic acid, advising the patient that these supplements are generally beneficial for nerve health and will likely resolve the symptoms. Option B. Focus on the patient's reported stress levels and suggest relaxation techniques, attributing the symptoms to anxiety-related paresthesias without performing a physical or neurological examination. Option C. Conduct a detailed neurological examination, including sensory testing, light touch, pinprick and motor strength assessment of intrinsic hand muscles, palpate for tenderness along the median nerve pathway, and consider electrodiagnostic studies if indicated, while formulating a differential diagnosis that includes carpal tunnel syndrome and other peripheral neuropathies. Option D. Advise the patient that these symptoms are common with aging and likely benign, recommending they simply avoid activities that aggravate the discomfort. Correct answer is C. Conduct a detailed neurological examination, including sensory testing, light touch, pinprick and motor strength assessment of intrinsic hand muscles, palpate for tenderness along the median nerve pathway, and consider electrodiagnostic studies if indicated, while formulating a differential diagnosis that includes carpal tunnel syndrome and other peripheral neuropathies. Explanation. Scenario analysis. This scenario presents a professional challenge due to the need to differentiate between a localized peripheral neuropathy and a more systemic neurological condition, requiring a thorough understanding of neuroanatomy and diagnostic principles within the scope of naturopathic practice as defined by NPLEX standards. The challenge lies in accurately assessing the extent and nature of the neurological deficit to guide appropriate therapeutic interventions. Correct approach analysis. The correct approach involves a systematic neurological examination focusing on sensory and motor deficits in specific dermatomes and myotomes, correlating findings with known peripheral nerve distributions. This aligns with the NPLEX scope of practice, which permits the assessment and management of conditions affecting the peripheral nervous system through naturopathic modalities. The emphasis on objective findings and differential diagnosis is paramount for safe and effective patient care, adhering to the ethical obligation to practice within one's competence and to avoid harm. Incorrect approaches analysis. An approach that solely relies on subjective patient reporting without objective neurological assessment fails to meet professional standards. It risks misdiagnosis and inappropriate treatment, potentially delaying necessary intervention for more serious underlying conditions. This is a failure to adhere to the principle of evidence-based practice and due diligence required by regulatory bodies. An approach that immediately prescribes broad-spectrum nutritional supplements without a clear diagnostic hypothesis or targeted assessment is also professionally unacceptable. While nutritional support can be part of naturopathic care, it must be guided by specific deficiencies or physiological imbalances identified through assessment, not as a default for undiagnosed symptoms. This deviates from the principle of individualized treatment and can lead to ineffective or even harmful interventions. An approach that dismisses the patient's symptoms as psychosomatic without a comprehensive physical and neurological workup is a significant ethical and professional failing. It demonstrates a lack of thoroughness and can result in the neglect of potentially serious organic pathology, violating the duty of care owed to the patient. Professional reasoning. Professionals facing such a scenario should employ a structured diagnostic process. This begins with a detailed history, followed by a comprehensive physical examination, including a targeted neurological assessment of the peripheral nervous system. Based on these findings, a differential diagnosis should be formulated, leading to appropriate investigations and a treatment plan that is evidence-informed and within the scope of naturopathic practice. Continuous reassessment and referral when indicated are crucial components of responsible patient management. Question 5. Process analysis reveals a 20-year-old patient presenting with persistent fatigue, occasional digestive upset, and feelings of being overwhelmed by academic and social pressures. The patient expresses a desire to improve energy levels and manage stress more effectively. Considering the typical growth and development stages relevant to naturopathic medical practice, which of the following approaches best addresses the patient's presenting concerns? Option A. Prescribe a stimulant medication to immediately address the fatigue, and recommend a generic stress reduction program without further exploration of the patient's specific developmental context. Option B. Advise the patient that fatigue and feeling overwhelmed are normal aspects of young adulthood and suggest they simply try to get more sleep and reduce their social commitments. Option C. Focus solely on dietary recommendations for digestive upset, assuming the fatigue and stress are unrelated and will resolve with improved digestion. Option D. Implement a nutritional protocol to address potential micronutrient deficiencies contributing to fatigue, coupled with stress management techniques such as mindfulness and adaptogenic herbs, while educating the patient on the physiological and psychological transitions common in early adulthood and how they may influence energy and stress levels. The correct answer is D. Implement a nutritional protocol to address potential micronutrient deficiencies contributing to fatigue, coupled with stress management techniques such as mindfulness and adaptogenic herbs, while educating the patient on the physiological and psychological transitions common in early adulthood and how they may influence energy and stress levels. Explanation: this scenario presents a professional challenge due to the need to apply knowledge of naturopathic principles to a patient's developmental stage, specifically focusing on the transition from adolescence to early adulthood. The naturopathic physician must integrate an understanding of the physiological, psychological, and social changes occurring during this period to provide appropriate and effective care. This requires a nuanced approach that goes beyond general health advice and considers the unique needs and vulnerabilities of a young adult. The correct approach emphasizes a holistic assessment that acknowledges the patient's current developmental stage and its impact on their health and well-being. This involves understanding the typical challenges and opportunities of early adulthood, such as identity formation, establishing independence, and navigating relationships, and how these can manifest physically and emotionally. A naturopathic physician's responsibility includes educating the patient about these developmental aspects and how they relate to their health goals, empowering them to make informed decisions. This aligns with the ethical imperative to provide patient-centered care and promote self-efficacy, which are core tenets of naturopathic practice. An incorrect approach that focuses solely on immediate physical symptoms, without considering the developmental context, fails to address the root causes or contributing factors that may be linked to the patient's age and life stage. This could lead to superficial treatment and a missed opportunity for comprehensive care. Ethically, this approach neglects the holistic nature of naturopathic medicine and may not adequately support the patient's overall development. Another incorrect approach that dismisses the patient's concerns as typical adolescent or young adult issues without further investigation is also professionally unacceptable. This demonstrates a lack of empathy and a failure to recognize that even common developmental challenges can be exacerbated by underlying health imbalances or can signal emerging health problems. It violates the principle of taking patient complaints seriously and conducting thorough assessments. A third incorrect approach that imposes adult-level health expectations without considering the patient's ongoing developmental transition can be counterproductive. This may create undue pressure or anxiety for the patient and fail to acknowledge the unique support and guidance needed during this formative period. It overlooks the importance of tailoring interventions to the individual's developmental readiness and capacity. The professional decision-making process for similar situations should involve a thorough assessment of the patient's developmental stage, considering their chronological age, psychosocial maturity, and any specific challenges they are facing. This should be followed by a holistic evaluation of their health status, integrating physical, mental, emotional, and social factors. The naturopathic physician should then collaboratively develop a treatment plan that is tailored to the patient's individual needs and developmental stage, prioritizing education, empowerment, and the promotion of long-term health and well-being. Question 6. To address the challenge of a patient presenting with acute, severe lower back pain radiating down the leg, which of the following diagnostic and management approaches best aligns with the regulatory framework and ethical standards for a licensed naturopathic physician? Option A. Immediately initiate a course of naturopathic spinal manipulation and prescribe anti-inflammatory herbal remedies, assuming the pain is a common muscular strain. Option B. Prescribe strong opioid analgesics for pain relief, as this is a common and effective treatment for severe back pain. Option C. Conduct a comprehensive naturopathic musculoskeletal assessment, including palpation, range of motion testing, and neurological screening, and consider referral to a medical specialist if red flags for serious pathology are identified or if symptoms do not improve with initial naturopathic management. Option D. Advise the patient to rest and apply heat, and suggest they return in 2 weeks if symptoms persist, without performing a detailed physical examination. The correct answer is C. Conduct a comprehensive naturopathic musculoskeletal assessment, including palpation, range of motion testing, and neurological screening, and consider referral to a medical specialist if red flags for serious pathology are identified or if symptoms do not improve with initial naturopathic management. Explanation. The scenario presents a common challenge for naturopathic physicians, differentiating between a musculoskeletal complaint that falls within the scope of naturopathic practice and one that requires referral to a conventional medical specialist. The challenge lies in accurately assessing the severity and underlying cause of the patient's pain, ensuring patient safety, and adhering to professional standards of care and regulatory guidelines. Naturopathic physicians are trained to assess and treat a wide range of conditions, including musculoskeletal issues, but they must also recognize their limitations and the necessity of collaboration with other healthcare providers when appropriate. The correct approach involves a thorough naturopathic assessment, including a detailed history, physical examination focusing on the musculoskeletal system, and consideration of relevant diagnostic imaging or laboratory tests if indicated and within the scope of practice. This approach prioritizes patient well-being by ensuring that the most appropriate diagnostic and therapeutic interventions are utilized. It aligns with the ethical principle of do no harm by avoiding unnecessary or potentially ineffective treatments, and by facilitating timely referral when a condition may be beyond the scope of naturopathic care or requires a different modality. Regulatory frameworks for naturopathic physicians typically emphasize the importance of accurate diagnosis, appropriate treatment, and referral when necessary, ensuring that care is delivered within the established scope of practice and in accordance with established standards of care. An incorrect approach would be to immediately prescribe naturopathic therapies for severe, acute, or potentially systemic musculoskeletal pain without a comprehensive assessment to rule out serious underlying pathology. This could lead to delayed diagnosis of conditions such as fractures, infections, or inflammatory arthropathies that require immediate conventional medical intervention. Such a failure to adequately assess and refer would represent a violation of professional standards of care and potentially regulatory requirements regarding scope of practice and patient safety. Another incorrect approach would be to dismiss the patient's symptoms as minor without a proper examination, potentially overlooking significant underlying issues. This demonstrates a lack of due diligence and could result in harm to the patient. The professional decision-making process for similar situations should involve a systematic approach. 1. Gather comprehensive patient information, history, symptoms, onset, duration, aggravating/alleviating factors. 2. Conduct a thorough physical examination relevant to the presenting complaint. 3. Consider differential diagnoses, including both conditions treatable within naturopathic scope and those requiring referral. 4. Determine if further diagnostic testing is necessary and within scope. 5. Based on the assessment, formulate a treatment plan that may include naturopathic modalities, lifestyle recommendations, or referral to another healthcare professional if the condition is outside the scope of practice, requires specialized intervention, or if there is suspicion of serious pathology. Question 7. Benchmark analysis indicates that a patient presents with chronic bloating, abdominal discomfort, and undigested food particles observed in stool, symptoms that could be indicative of impaired pancreatic enzyme function. Considering the scope of practice for a licensed naturopathic physician, which of the following represents the most appropriate initial course of action? Option A. Recommend a trial of broad-spectrum digestive enzyme supplementation to address potential maldigestion. Option B. Conduct a thorough patient history and physical examination and consider appropriate diagnostic testing to identify specific enzyme deficiencies or contributing factors before recommending targeted interventions. Option C. Immediately diagnose a specific pancreatic enzyme deficiency and prescribe pharmaceutical enzyme replacement therapy. Option D. Advise the patient to eliminate all complex carbohydrates from their diet to reduce digestive burden. The correct answer is A. Recommend a trial of broad-spectrum digestive enzyme supplementation to address potential maldigestion. Explanation. Scenario analysis. A naturopathic physician is presented with a patient experiencing symptoms suggestive of impaired digestive enzyme activity. The challenge lies in accurately identifying the specific enzyme deficiency or dysfunction and recommending an appropriate therapeutic intervention within the scope of naturopathic practice adhering to evidence-based guidelines and regulatory limitations. Misdiagnosis or inappropriate supplementation could lead to patient harm, ineffective treatment, and potential regulatory scrutiny. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates patient history, physical examination, and appropriate diagnostic testing to identify potential enzyme dysfunctions. Recommending targeted digestive enzyme supplementation, when indicated by the assessment and supported by scientific literature, aligns with the scope of practice for naturopathic physicians. This approach prioritizes patient safety and efficacy by addressing the root cause of the symptoms through a well-reasoned, evidence-informed intervention. Adherence to NPLEX guidelines and relevant state/provincial regulations regarding the use of supplements and diagnostic modalities is paramount. Incorrect approaches analysis. Recommending broad-spectrum enzyme supplementation without a clear diagnostic rationale or patient-specific indication is professionally unacceptable. This approach lacks specificity, may lead to unnecessary patient expense, and could potentially disrupt the body's natural enzymatic processes without providing therapeutic benefit. It fails to demonstrate a commitment to evidence-based practice and patient-centered care. Diagnosing a specific enzyme deficiency solely based on a single symptom without further investigation is a significant regulatory and ethical failure. This constitutes a premature diagnosis and bypasses the necessary diagnostic process, potentially leading to incorrect treatment and patient harm. It demonstrates a lack of due diligence and adherence to professional standards of care. Prescribing pharmaceutical medications for enzyme replacement therapy without appropriate licensure and scope of practice authorization is a critical regulatory violation. Naturopathic physicians operate within specific scopes of practice, and the use of prescription pharmaceuticals is typically restricted to those with specific prescriptive authority, which may not be universally granted to all naturopathic physicians, depending on jurisdiction. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with thorough patient assessment, including detailed history-taking and physical examination. This is followed by the judicious selection of diagnostic tools to confirm or rule out suspected conditions. Interventions should be evidence-based, patient-specific, and within the established scope of practice. Continuous professional development and staying abreast of current research and regulatory updates are essential for providing optimal patient care and maintaining professional integrity. Question 8. Strategic planning requires a naturopathic physician to consider a patient presenting with chronic, intermittent abdominal pain and bloating. The patient expresses a strong desire to try a specific, novel herbal protocol they read about online, claiming it is a miracle cure for their symptoms. The physician has not encountered this specific protocol in mainstream scientific literature or within established naturopathic clinical guidelines. What is the most appropriate initial course of action for the physician? Option A. Immediately prescribe the patient's requested herbal protocol, as patient preference is paramount in treatment planning and can enhance compliance. Option B. Agree to trial the patient's requested herbal protocol for a short period to maintain the therapeutic relationship, with the understanding that it may not be effective. Option C. Inform the patient that their requested protocol is not recognized by the profession and refuse to discuss it further, focusing solely on conventional medical treatments. Option D. Conduct a thorough diagnostic workup to identify the underlying cause of the patient's symptoms, discuss evidence-based treatment options with the patient, and explore the safety and efficacy of the patient's requested protocol based on available scientific data, if any. The correct answer is D. Conduct a thorough diagnostic workup to identify the underlying cause of the patient's symptoms, discuss evidence-based treatment options with the patient, and explore the safety and efficacy of the patient's requested protocol based on available scientific data, if any. Explanation. This scenario presents a professional challenge because the naturopathic physician must balance patient autonomy and informed consent with the ethical imperative to provide evidence-based care and avoid harm. The physician must navigate the patient's strong preference for a specific, potentially unproven or contraindicated treatment, while adhering to the standards of practice and regulatory guidelines governing naturopathic physicians in the relevant jurisdiction, assumed to be the U.S. for NPLEX context. The correct approach represents best professional practice because it prioritizes a thorough diagnostic process and evidence-based treatment planning. This involves a comprehensive patient history, physical examination, and appropriate diagnostic testing to accurately identify the underlying cause of the digestive distress. Subsequently, the physician must discuss all viable treatment options, including those supported by scientific literature and clinical consensus, as well as their respective risks, benefits, and alternatives. This aligns with the ethical principles of beneficence, non-maleficence, and informed consent, as well as the regulatory requirements for professional conduct and scope of practice. The physician's responsibility is to guide the patient towards the safest and most effective treatment plan, even if it differs from the patient's initial request, by providing clear, evidence-based information. An incorrect approach that involves immediately prescribing the patient's preferred treatment without adequate investigation or consideration of alternatives fails to uphold the principle of non-maleficence. This could lead to ineffective treatment, delayed diagnosis of a more serious condition, or adverse effects from an inappropriate therapy. It also violates the ethical duty to provide evidence-based care and the regulatory expectation that practitioners act within their scope and with due diligence. Another incorrect approach, such as dismissing the patient's concerns or refusing to consider any alternative treatments, demonstrates a lack of respect for patient autonomy and can damage the therapeutic relationship. While the physician has a duty to provide evidence-based care, this does not preclude exploring patient preferences and concerns within the bounds of safe and effective practice. Ethically, this approach can be seen as paternalistic and may lead to patient dissatisfaction and noncompliance. A third incorrect approach, such as agreeing to the patient's request solely to maintain the patient relationship without a genuine belief in the treatment's efficacy or safety, constitutes a breach of professional integrity and ethical responsibility. This is a form of deception and can lead to patient harm, violating the core tenets of naturopathic practice and regulatory standards. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly assess the patient's condition through history, physical exam, and diagnostics. 2. Identify potential diagnoses and their underlying etiologies. 3. Research and evaluate all potential treatment options, prioritizing those with strong evidence of safety and efficacy. 4. Engage in open and honest communication with the patient, explaining the diagnostic findings and all treatment options, including risks, benefits, and alternatives. 5. Collaboratively develop a treatment plan that respects patient preferences while adhering to professional standards and ethical obligations. 6. Document the entire process, including patient discussions and the rationale for the chosen treatment plan. Question 9. The audit findings indicate a discrepancy between a patient's reported symptoms of recurrent gastrointestinal distress and the initial diagnostic assessment. The patient, a 35-year-old female, presents with intermittent abdominal pain, bloating, and malabsorption issues. Her medical history reveals a childhood diagnosis of a digestive anomaly that was reportedly managed conservatively. Further investigation is required to determine the most likely anatomical basis for her ongoing symptoms, considering the principles of developmental anatomy. Which of the following anatomical structures, if exhibiting a developmental anomaly, would most plausibly explain the patient's presentation of malabsorption and gastrointestinal distress in adulthood? Option A. A persistent thyroglossal duct cyst, which arises from the embryonic thyroglossal duct and is typically located in the anterior neck, unrelated to gastrointestinal function. Option B. An accessory spleen, a small detached nodule of splenic tissue that develops from mesenchymal cells during embryonic development and is usually asymptomatic. Option C. A patent ductus arteriosus, a congenital heart defect resulting from the failure of the ductus arteriosus to close after birth, affecting cardiovascular function. Option D. A Meckel's diverticulum, a remnant of the omphalomesenteric duct, which can lead to complications such as obstruction or bleeding, and in some cases, malabsorption. Correct answer is D. A Meckel's diverticulum, a remnant of the omphalomesenteric duct, which can lead to complications such as obstruction or bleeding, and in some cases, malabsorption. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the naturopathic physician to reconcile a patient's reported symptoms with established developmental anatomy principles, particularly concerning a congenital anomaly. The challenge lies in accurately identifying the underlying anatomical basis of the patient's condition and ensuring that the diagnostic and treatment plan aligns with the expected developmental trajectory and potential complications. Misinterpretation can lead to delayed or inappropriate care, impacting patient outcomes. Correct approach analysis. The correct approach involves a thorough review of the patient's history, physical examination findings, and diagnostic imaging, cross-referencing these with established knowledge of embryonic development and the typical formation of the affected organ system. This ensures that the diagnosis is grounded in scientific understanding of developmental anatomy, leading to a targeted and effective treatment plan. Adherence to NPLEX standards for diagnostic reasoning and patient care, which implicitly require a strong foundation in basic sciences like developmental anatomy, is paramount. Incorrect approaches analysis. One incorrect approach would be to dismiss the patient's reported symptoms as unrelated to developmental anatomy without a comprehensive investigation. This fails to acknowledge the potential for congenital anomalies to manifest later in life or present with atypical symptoms, violating the principle of thorough patient assessment and potentially leading to misdiagnoses. Another incorrect approach would be to rely solely on anecdotal evidence or unverified patient claims regarding the condition's origin, without correlating them with established anatomical facts. This bypasses the scientific rigor expected of a licensed naturopathic physician and could result in ineffective or harmful interventions. A third incorrect approach would be to propose a treatment plan that does not address the identified anatomical abnormality or its functional consequences. This demonstrates a lack of understanding of how developmental deviations impact physiological processes and fails to provide comprehensive patient care. Professional reasoning. Professionals should approach such situations by systematically gathering all relevant patient data, critically evaluating it against established scientific principles of developmental anatomy, and formulating a differential diagnosis. This process involves considering the embryological origins of the affected structures, potential errors in development, and the resulting anatomical and physiological consequences. The chosen diagnostic and therapeutic interventions must be evidence-based and directly address the identified anatomical and functional issues, ensuring patient safety and promoting optimal health outcomes in accordance with NPLEX standards. Question 10. Consider a scenario where a patient presents with new onset, intermittent headaches, mild photophobia, and occasional dizziness. The patient reports a history of migraines, but states these symptoms feel different and are accompanied by a subtle, progressive difficulty with fine motor skills in their left hand. What is the most appropriate initial risk assessment approach for a naturopathic physician? Option A. Focus solely on the patient's reported history of migraines and recommend a standard naturopathic protocol for migraine management without further investigation into the new symptoms. Option B. Advise the patient that these symptoms are likely a variation of their usual migraines and recommend lifestyle modifications for stress reduction. Option C. Conduct a thorough neurological examination, inquire about the onset, frequency, and character of all symptoms, and consider referral for appropriate diagnostic imaging to rule out serious CNS pathology. Option D. Immediately prescribe a high-dose herbal supplement known for its analgesic properties to address the headaches and advise the patient to rest. The correct answer is C. Conduct a thorough neurological examination, inquire about the onset, frequency, and character of all symptoms, and consider referral for appropriate diagnostic imaging to rule out serious CNS pathology. Explanation. This scenario presents a professional challenge due to the inherent complexity of central nervous system, CNS conditions, and the critical need for accurate risk assessment in naturopathic practice. Naturopathic physicians are expected to employ a comprehensive and evidence-informed approach, integrating patient history, physical examination, and appropriate diagnostic measures to identify potential risks and contraindications. The risk assessment process is not merely about identifying a condition, but understanding its severity, progression, and potential interactions with naturopathic therapies. The correct approach represents best professional practice because it prioritizes patient safety and efficacy through a systematic and thorough evaluation. This involves gathering comprehensive subjective and objective data, considering differential diagnoses, and utilizing diagnostic tools that are within the scope of naturopathic practice and aligned with established clinical guidelines. This approach ensures that any proposed naturopathic interventions are safe, appropriate, and unlikely to exacerbate the patient's underlying condition or cause harm. It reflects a commitment to evidence-based practice and adherence to professional standards of care, which are implicitly or explicitly governed by the regulatory framework of the Naturopathic Physicians Licensing Examination (NPLEX). An incorrect approach that relies solely on subjective reporting without objective confirmation fails to meet professional standards. This could lead to misdiagnosis or the overlooking of serious underlying pathology, potentially delaying necessary conventional medical care or leading to the prescription of inappropriate naturopathic therapies. Such an approach would be considered negligent and a violation of the duty of care owed to the patient, as it bypasses essential diagnostic steps mandated by responsible medical practice. Another incorrect approach that involves immediately recommending aggressive naturopathic treatments without a clear diagnosis or risk assessment is equally problematic. This demonstrates a lack of due diligence and a failure to consider the potential for adverse effects or contraindications. It prioritizes intervention over careful evaluation, which is contrary to the principles of safe and ethical naturopathic practice. This approach could result in harm to the patient and professional misconduct. A third incorrect approach that involves deferring all care to conventional medical practitioners without any attempt at naturopathic assessment or management, when appropriate, may also be considered a failure. While collaboration is essential, a naturopathic physician's role includes assessing the patient's suitability for naturopathic care and identifying potential adjunctive therapies. Unnecessary deferral can limit the patient's access to the full spectrum of care that naturopathic medicine can offer, provided it is safe and indicated. The professional decision-making process for similar situations should involve a structured approach. 1. Thorough patient history and symptom review. 2. Comprehensive physical examination, including relevant neurological assessments. 3. Consideration of differential diagnosis for the reported symptoms. 4. Identification of appropriate diagnostic tools, e.g., laboratory tests, imaging referrals, within the scope of naturopathic practice or in collaboration with other healthcare providers. 5. Risk assessment for proposed naturopathic intervention, considering potential contraindications, interactions, and side effects. 6. Development of a treatment plan that is individualized, evidence-informed, and prioritizes patient safety. 7. Clear communication with the patient regarding diagnosis, prognosis, treatment options, and potential risks. 8. Ongoing monitoring and reassessment of the patient's condition and response to treatment. Question 11. The investigation demonstrates a patient presenting with persistent fatigue, muscle weakness, and intermittent gastrointestinal distress. The patient also reports experiencing increased anxiety and difficulty concentrating. The naturopathic physician is considering the potential involvement of the endocrine, nervous, and digestive systems in the patient's presentation. Which of the following diagnostic and therapeutic approaches best aligns with the principles of naturopathic medicine and the regulatory framework for its practice? Option A. Referring the patient immediately to a specialist in each suspected system, endocrinology, neurology, gastroenterology, without performing any initial naturopathic assessment or diagnostic workup. Option B. Focusing solely on managing the fatigue with high-dose stimulants and recommending a restrictive elimination diet without further investigation into the underlying causes of the gastrointestinal distress or anxiety. Option C. Conducting a thorough patient history and physical examination, followed by targeted laboratory assessments to evaluate endocrine function, neurotransmitter levels, and gut microbiome health, and developing an individualized treatment plan that may include nutritional support, botanical medicine, and lifestyle modifications to address identified imbalances across these systems. Option D. Prescribing a broad-spectrum antibiotic to address potential underlying infections contributing to the gastrointestinal distress, while also recommending a stimulant medication to counteract the fatigue and improve concentration. The correct answer is C. Conducting a thorough patient history and physical examination, followed by targeted laboratory assessments to evaluate endocrine function, neurotransmitter levels, and gut microbiome health, and developing an individualized treatment plan that may include nutritional support, botanical medicine, and lifestyle modifications to address identified imbalances across these systems. Explanation. The investigation demonstrates a patient presenting with symptoms suggestive of a complex interplay between multiple human body systems, requiring a naturopathic physician to integrate their understanding of physiological processes with diagnostic and therapeutic principles. The challenge lies in accurately identifying the primary system dysfunction and the cascading effects on other systems, while adhering to the scope of practice and ethical guidelines for naturopathic physicians as defined by the NPLEX regulatory framework. This requires a thorough assessment that goes beyond symptomatic relief to address root causes within the context of the whole person. The correct approach involves a comprehensive assessment that systematically evaluates the patient's reported symptoms in relation to the known functions of the human body systems. This includes gathering a detailed history, performing a physical examination, and potentially utilizing appropriate diagnostic modalities within the scope of naturopathic practice. The physician must then synthesize this information to formulate a differential diagnosis that considers the most likely primary system involvement and its impact on other systems. Treatment planning should be individualized, evidence-informed, and aligned with naturopathic principles, focusing on restoring balance and supporting the body's inherent healing capacity. This approach is best professional practice because it prioritizes patient safety, efficacy of treatment, and adherence to the established standards of care for naturopathic physicians, ensuring that interventions are appropriate and within the physician's competency. An incorrect approach would be to focus solely on the most prominent symptom without investigating its underlying systemic cause. This could lead to a superficial treatment that fails to address the root of the problem, potentially allowing the underlying condition to progress. Another incorrect approach would be to recommend diagnostic tests or treatments that fall outside the scope of naturopathic practice as defined by NPLEX regulations, which could result in legal and ethical violations. Furthermore, making a diagnosis or treatment recommendation based on incomplete information or without considering the interconnectedness of body systems would be professionally unacceptable, as it risks misdiagnosis and inappropriate care. Professional decision-making in such situations requires a systematic process of information gathering, critical analysis, and application of knowledge. Naturopathic physicians should begin by actively listening to the patient's concerns and then proceed with a structured assessment that explores the patient's health history, lifestyle, and environmental factors. They must then apply their understanding of human physiology and pathophysiology to identify potential system dysfunctions. When formulating a treatment plan, they should prioritize interventions that are safe, effective, and aligned with naturopathic philosophy, always considering the patient's individual needs and circumstances. Consultation with other healthcare professionals may be appropriate when a patient's condition extends beyond the scope of naturopathic practice. Question 12. Upon reviewing the diagnostic workup for a patient presenting with progressive peripheral neuropathy and significant cognitive decline, the patient expresses a strong desire to forego further neuroimaging and instead focus solely on a specific herbal supplement regimen they read about online. The physician suspects a more serious underlying condition that requires advanced diagnostic investigation. Option A. Insist on immediate neuroimaging, overriding the patient's expressed concerns about cost and invasiveness, and refuse to discuss any alternative treatment approaches until the imaging is completed. Option B. Engage in a detailed discussion with the patient, explaining the rationale for further neuroimaging, outlining potential diagnoses that could be missed without it, and discussing the risks and benefits of both pursuing advanced diagnostics and relying solely on the herbal supplement, ultimately seeking a shared decision on the next steps. Option C. Immediately proceed with the patient's requested herbal supplement regimen and discontinue all further diagnostic investigations to respect their stated wishes. Option D. Agree to the patient's request to forego neuroimaging and focus on the herbal supplement, but without further discussion or explanation of the potential consequences of delaying diagnosis. The correct answer is B. Engage in a detailed discussion with the patient, explaining the rationale for further neuroimaging, outlining potential diagnoses that could be missed without it, and discussing the risks and benefits of both pursuing advanced diagnostics and relying solely on the herbal supplement, ultimately seeking a shared decision on the next steps. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the naturopathic physician's professional judgment, regarding the appropriate diagnostic and treatment pathway for a complex neurological condition. The physician must balance patient autonomy with the ethical obligation to provide competent care and adhere to established professional standards. The correct approach involves a thorough and collaborative discussion with the patient, exploring the rationale behind their specific requests, while also clearly articulating the physician's professional assessment and recommended course of action. This includes explaining the potential benefits and risks of all proposed interventions, ensuring informed consent is obtained for any chosen path, and documenting the entire process meticulously. This aligns with the ethical principles of beneficence, non-maleficence, and patient autonomy, as well as the regulatory framework governing naturopathic practice, which emphasizes patient-centered care and evidence-informed decision-making. An incorrect approach would be to dismiss the patient's concerns or requests outright without adequate exploration. This could be seen as a failure to respect patient autonomy and could lead to a breakdown in the therapeutic relationship. Another incorrect approach would be to proceed with a treatment plan that the physician believes is not in the patient's best interest, even if the patient insists, without a clear and documented rationale for overriding their wishes based on established medical contraindications or significant risks. This would violate the principle of non-maleficence and potentially the standard of care. Blindly following a patient's request for a specific diagnostic test or treatment without a sound clinical basis, even if it aligns with their perceived preferences, also represents a failure in professional judgment and could lead to unnecessary costs, delays in effective treatment, or even harm. The professional decision-making process in such situations requires active listening, empathetic communication, a clear understanding of the patient's values and goals, and a commitment to evidence-based practice. It involves a careful weighing of risks and benefits, a willingness to educate the patient, and a commitment to shared decision-making within the bounds of professional competence and ethical responsibility. Question 13. Risk assessment procedures indicate a patient diagnosed with hypothyroidism, currently stable on levothyroxine, expresses a strong desire to incorporate a specific herbal supplement purported to boost thyroid function, alongside their conventional medication. The naturopathic physician has reviewed the available evidence for the herbal supplement and identified a potential for interaction with levothyroxine, which could impact thyroid hormone levels and necessitate dose adjustments. The physician must determine the most appropriate course of action to ensure patient safety and therapeutic efficacy. Which of the following approaches best aligns with regulatory requirements and professional best practices for managing this patient's request? Option A. Thoroughly explain the potential for drug-herb interactions between the herbal supplement and levothyroxine. Discuss the current scientific evidence, or lack thereof, supporting the herbal supplement's efficacy and safety in this context, and collaboratively develop a treatment plan that either incorporates the supplement with close monitoring or advises against its use based on the risk-benefit analysis and patient's informed decision. Option B. Immediately increase the dosage of levothyroxine to preemptively counteract any potential impact of the herbal supplement, without further discussion or investigation into the supplement itself. Option C. Advise the patient that herbal supplements are not evidence-based for thyroid conditions and refuse to discuss or consider their use, reiterating the importance of adhering solely to the prescribed levothyroxine. Option D. Prescribe the herbal supplement as requested, assuming the patient's desire for complementary therapy outweighs potential risks, and instruct the patient to report any significant changes in symptoms. The correct answer is A. Thoroughly explain the potential for drug-herb interactions between the herbal supplement and levothyroxine. Discuss the current scientific evidence, or lack thereof, supporting the herbal supplement's efficacy and safety in this context, and collaboratively develop a treatment plan that either incorporates the supplement with close monitoring or advises against its use based on the risk-benefit analysis and patient's informed decision. Explanation. This scenario presents a professional challenge due to the need to balance patient autonomy and informed consent with the naturopathic physician's responsibility to provide safe and effective care, particularly when a patient's understanding of a complex endocrine condition might be limited. The physician must ensure the patient comprehends the implications of their chosen treatment path, including potential risks, benefits, and alternatives, within the scope of naturopathic practice as defined by NPLEX governing regulations. The correct approach represents best professional practice because it prioritizes comprehensive patient education and shared decision-making. By thoroughly explaining the pathophysiology of hypothyroidism, the mechanisms of action for both prescribed levothyroxine and the proposed herbal adjunct, potential interactions, and the importance of regular monitoring, the physician empowers the patient to make an informed choice. This aligns with ethical principles of beneficence and non-maleficence, ensuring the patient's well-being is paramount, and adheres to regulatory expectations for clear communication and documentation of informed consent. An incorrect approach that involves proceeding with the herbal adjunct without ensuring the patient fully grasps the potential for drug-herb interactions or the implications of altering a stable thyroid hormone replacement regimen would be a significant regulatory and ethical failure. This could lead to suboptimal treatment outcomes, adverse events, and a breach of the physician's duty of care. Another incorrect approach, such as dismissing the patient's interest in complementary therapies outright without a thorough discussion of their safety and efficacy in conjunction with conventional treatment, fails to respect patient autonomy and may damage the therapeutic relationship, potentially leading the patient to pursue unmonitored or unsafe alternatives. Professional decision-making in such situations requires a systematic approach. First, accurately diagnose and understand the patient's condition. Second, assess the patient's health literacy and understanding of their condition and proposed treatments. Third, clearly and comprehensively explain all treatment options, including conventional and complementary therapies, detailing their respective risks, benefits, and evidence base. Fourth, engage in a dialogue to address patient concerns and preferences. And finally, collaboratively develop a treatment plan that is safe, effective, and aligned with the patient's informed consent, with thorough documentation of the entire process. Question 14. Examination of the data shows a patient presenting with sharp, localized pain in the anterior aspect of the right shoulder, exacerbated by overhead arm movements and relieved by rest. The patient also reports a clicking sensation during certain arm rotations. Based on this presentation and your understanding of anatomy and physiology, which anatomical structure is most likely implicated in this patient's condition? Option A, the supraspinatus tendon. Option B, the deltoid muscle. Option C, the brachial plexus. Option D, the clavicle. The correct answer is A, the supraspinatus tendon. Explanation. Scenario analysis. A naturopathic physician is presented with a patient exhibiting symptoms suggestive of a specific anatomical dysfunction. The challenge lies in accurately identifying the affected anatomical structure and its physiological implications based on the presented clinical data, while adhering to the scope of practice and diagnostic standards expected of a licensed naturopathic physician. Misinterpretation can lead to inappropriate treatment plans, potentially delaying effective care or causing harm. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's signs and symptoms, correlating them with known anatomical structures and their physiological functions. This requires a thorough understanding of the musculoskeletal system, nervous system, and their interrelationships. By considering the location, nature, and exacerbating/alleviating factors of the patient's complaints, the physician can logically deduce the most probable anatomical source of the dysfunction. This aligns with the NPLEX examination's emphasis on foundational scientific knowledge and its application in clinical reasoning, ensuring that diagnostic hypotheses are grounded in established anatomical and physiological principles. Incorrect approaches analysis. One incorrect approach would be to immediately jump to a specific therapeutic intervention without a clear diagnostic hypothesis. This bypasses the critical step of anatomical and physiological assessment, potentially leading to the application of treatments that are not indicated for the underlying cause, violating the principle of providing evidence-based and targeted care. This also fails to meet the diagnostic expectations for a licensed naturopathic physician. Another incorrect approach would be to attribute the symptoms solely to a generalized inflammatory process without pinpointing the specific anatomical structure involved. While inflammation may be present, understanding the precise anatomical origin is crucial for effective treatment. This approach lacks the specificity required for accurate diagnosis and treatment planning, and it does not demonstrate the depth of anatomical and physiological understanding expected. A third incorrect approach would be to rely solely on patient self-reporting of the anatomical issue without independent clinical correlation. While patient history is vital, It must be corroborated with objective findings derived from anatomical and physiological knowledge. Over-reliance on subjective reporting, without applying scientific principles, can lead to diagnostic errors. Professional reasoning. Professionals should employ a decision-making framework that prioritizes a systematic, evidence-based approach. This involves 1. Thoroughly gathering patient history, including detailed symptom description. 2. Applying foundational knowledge of anatomy and physiology to interpret signs and symptoms. 3. Formulating differential diagnoses based on this interpretation. 4. Selecting appropriate diagnostic tools or further assessments if necessary. 5. Developing a targeted treatment plan based on the confirmed diagnosis. This structured process ensures that clinical decisions are logical, scientifically sound, and aligned with professional standards of care. Question 15. Performance analysis shows a patient presents with progressive difficulty with fine motor skills in their dominant hand, accompanied by intermittent tingling sensations radiating up the arm. The naturopathic physician suspects a neurological etiology. Which of the following neuroanatomical considerations is most critical for guiding the initial diagnostic and therapeutic approach within the scope of naturopathic practice? Option A. Evaluating the patient's overall cardiovascular health and blood pressure readings to rule out cerebrovascular accidents. Option B. Identifying the specific sensory and motor pathways involved in hand dexterity and sensation, and considering potential points of compromise along the corticospinal tract and peripheral nerves. Option C. Determining the patient's genetic predisposition to neurodegenerative diseases through family history analysis. Option D. Assessing the patient's endocrine function, particularly thyroid hormone levels, as a potential cause of generalized neurological symptoms. The correct answer is B. Identifying the specific sensory and motor pathways involved in hand dexterity and sensation, and considering potential points of compromise along the corticospinal tract and peripheral nerves. Explanation. This scenario is professionally challenging because it requires a naturopathic physician to integrate knowledge of neuroanatomy with the assessment and management of a patient presenting with complex neurological symptoms. The physician must accurately identify the affected neural pathways to formulate an appropriate differential diagnosis and treatment plan, adhering strictly to the scope of practice and ethical guidelines for naturopathic physicians as defined by the NPLEX jurisdiction. The correct approach represents best professional practice because it demonstrates a systematic and evidence-based method for diagnosing and managing neurological conditions. It involves a thorough understanding of neuroanatomy to correlate patient-reported symptoms with specific brain regions or neural tracts. This allows for the development of targeted diagnostic investigations and therapeutic interventions that are within the scope of naturopathic medicine, prioritizing patient safety and efficacy. Adherence to NPLEX standards ensures that the physician is acting within their licensed capabilities and providing care that is consistent with the profession's established competencies. An incorrect approach that relies solely on symptom presentation without a foundational understanding of neuroanatomy would be professionally unacceptable. This failure to connect symptoms to underlying neural structures could lead to misdiagnosis, delayed or inappropriate treatment, and potential harm to the patient. It would represent a deviation from the expected standard of care for a licensed naturopathic physician and could violate ethical obligations to provide competent care. Another incorrect approach that involves recommending interventions outside the scope of naturopathic practice, even if theoretically related to neurological function, would be a significant regulatory and ethical failure. This could include prescribing pharmaceutical drugs or performing surgical procedures, which are outside the defined scope of practice for naturopathic physicians in most NPLEX-governed jurisdictions. Such actions would constitute practicing medicine without a license and would expose both the patient and the physician to serious legal and professional repercussions. A further incorrect approach might involve dismissing the patient's symptoms or attributing them to non-neurological causes without adequate investigation, based on a superficial understanding of neuroanatomy. This would be a failure of due diligence and could result in the patient's condition worsening due to lack of appropriate care, representing a breach of the physician's duty of care. The professional decision-making process for similar situations should involve 1. Active listening and thorough patient history taking, focusing on the nature, onset, duration, and characteristics of neurological symptoms. 2. Applying knowledge of neuroanatomy to hypothesize potential affected areas and pathways. 3. Developing a differential diagnosis based on this neuroanatomical correlation. 4. Formulating a diagnostic plan that may include physical examinations, relevant laboratory tests, and referrals, all within the scope of naturopathic practice. 5. Designing a treatment plan that utilizes naturopathic modalities to address the identified root causes and support neurological function, while always respecting the boundaries of the profession. Question 16. The performance metrics show a patient presenting with symptoms suggestive of hypothyroidism. The patient reports having researched a specific herbal supplement online and requests a prescription for it, stating they believe it will directly address their thyroid hormone levels. The naturopathic physician has reviewed the patient's initial lab work, which indicates a suboptimal thyroid function, but has not yet conducted a comprehensive physical examination or explored the patient's lifestyle factors in detail. What is the most appropriate next step for the naturopathic physician in managing this patient's endocrine concerns? Option A. Immediately prescribe the requested herbal supplement as requested by the patient, assuming their research is accurate and will address the thyroid imbalance. Option B. Conduct a thorough physical examination. Gather a detailed patient history including lifestyle factors and potential interactions, and critically evaluate the scientific evidence for the requested herbal supplement's efficacy and safety in managing hypothyroidism before discussing treatment options with the patient. Option C. Refuse to prescribe the herbal supplement outright, informing the patient that it is not a recognized treatment for hypothyroidism and suggesting they consult with their primary care physician. Option D. Proceed with prescribing the herbal supplement based on the patient's request without further investigation to maintain patient satisfaction and adherence. The correct answer is B. Conduct a thorough physical examination. Gather a detailed patient history including lifestyle factors and potential interactions, and critically evaluate the scientific evidence for the requested herbal supplement's efficacy and safety in managing hypothyroidism before discussing treatment options with the patient. Explanation. This scenario presents a professional challenge due to the need to balance patient autonomy with the naturopathic physician's responsibility to provide safe and effective care within the established scope of practice and regulatory guidelines. The physician must critically evaluate the patient's request for a specific supplement, considering its efficacy, safety, potential interactions, and the underlying rationale for the request, all while adhering to NPLEX-defined standards for naturopathic medical practice. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-informed, and patient-centered assessment. This involves gathering detailed patient history, understanding the patient's goals, and evaluating the scientific literature regarding the requested supplement's use in managing the patient's endocrine condition. It also necessitates considering potential risks, benefits, and alternatives, and then collaboratively developing a treatment plan that aligns with the patient's needs and the physician's professional judgment, all within the regulatory framework governing naturopathic physicians. This approach upholds the ethical principles of beneficence, non-maleficence, and respect for patient autonomy, while ensuring practice aligns with NPLEX standards for scope and competence. An incorrect approach that involves immediately prescribing the supplement without thorough assessment fails to uphold the principle of non-maleficence. It bypasses the crucial step of evaluating potential contraindications, drug-herb interactions, or the supplement's actual efficacy for the specific patient's condition, potentially leading to harm or ineffective treatment. This also disregards the professional obligation to practice evidence-based medicine, a cornerstone of naturopathic practice as outlined by NPLEX. Another incorrect approach, that of outright refusal without explanation or exploration of alternatives, undermines patient autonomy and the therapeutic relationship. The physician may have concerns. A complete dismissal without engaging the patient in a discussion about their concerns and exploring other evidence-based options is ethically problematic and does not reflect best professional practice in patient care. It fails to educate the patient and collaboratively problem solve. A third incorrect approach, focusing solely on the patient's stated desire without independent clinical evaluation, risks practicing outside the scope of professional judgment and potentially recommending an inappropriate or harmful intervention. The physician's role is to guide treatment based on their expertise and the best available evidence, not simply to fulfill a patient's request without critical assessment. This can lead to a failure to address the root cause of the endocrine imbalance and may expose the patient to unnecessary risks. The professional decision-making process for similar situations should involve a systematic approach. 1. Patient assessment. Conduct a thorough history including current symptoms, past medical history, family history, lifestyle, and all current medications and supplements. 2. Evidence review. Critically evaluate the scientific literature regarding the efficacy, safety, and appropriate dosing of the requested intervention for the patient's specific condition. 3. Risk-benefit analysis. Weigh the potential benefits against the potential risks and side effects of the proposed intervention. 4. Differential diagnosis and alternative treatments. Consider other potential causes for the patient's symptoms and explore evidence-based alternative or complementary treatment options. 5. Patient education and shared decision-making. Clearly communicate findings, risks, benefits, and alternatives to the patient, and involve them in the decision-making process to develop a mutually agreed-upon treatment plan. 6. Documentation. Meticulously document the assessment, rationale for decisions, and the agreed-upon treatment plan. Question 17. Analysis of a patient presenting with chronic fatigue, unexplained weight loss, and persistent gastrointestinal distress requires a naturopathic physician to consider various disease mechanisms. Which of the following approaches best reflects the professional and regulatory expectations for diagnosing and managing such a complex presentation within the NPLEX framework? Option A. Prioritize a detailed investigation into the underlying pathophysiology of the patient's symptoms, considering potential autoimmune, infectious, endocrine, or neoplastic processes, and develop an individualized, evidence-informed treatment plan that addresses the identified mechanisms while ensuring patient safety and informed consent. Option B. Prescribe a course of high-dose nutritional supplements targeting general vitality and gut health, assuming the symptoms are primarily due to nutritional deficiencies, and deferring any further diagnostic investigation unless the patient's condition significantly deteriorates. Option C. Immediately recommend a broad spectrum of unproven or experimental naturopathic therapies based on anecdotal reports of success for similar symptoms, without a thorough diagnostic workup or consideration of established disease mechanisms. Option D. Focus primarily on symptomatic relief for the fatigue and gastrointestinal issues, recommending common over-the-counter remedies and lifestyle advice without delving deeply into the specific disease mechanisms, as these can be complex and time-consuming to investigate. The correct answer is A. Prioritize a detailed investigation into the underlying pathophysiology of the patient's symptoms, considering potential autoimmune, infectious, endocrine, or neoplastic processes, and develop an individualized, evidence-informed treatment plan that addresses the identified mechanisms while ensuring patient safety and informed consent. Explanation. This scenario is professionally challenging because it requires the naturopathic physician to integrate complex disease mechanisms with patient-specific factors and adhere to the ethical and regulatory standards governing naturopathic practice within the NPLEX jurisdiction. The physician must not only understand the pathophysiology of the patient's condition, but also apply this knowledge in a manner that is safe, effective, and compliant with established guidelines. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-informed, and individualized treatment plan. This involves a thorough understanding of the disease mechanism, its impact on the patient's physiology, and the potential interactions with proposed naturopathic therapies. It emphasizes patient education and shared decision-making, aligning with ethical principles of autonomy and informed consent. Furthermore, it necessitates staying current with scientific literature and regulatory updates relevant to naturopathic medicine, ensuring that all interventions are within the scope of practice and supported by appropriate evidence. An incorrect approach that focuses solely on a single symptom without investigating the underlying disease mechanism is professionally unacceptable. This fails to address the root cause of the patient's illness, potentially leading to ineffective treatment, delayed diagnosis of serious conditions, and patient harm. It violates the ethical duty to provide competent care and may contravene regulatory requirements for thorough patient assessment. Another incorrect approach that relies on anecdotal evidence or unverified therapies Disregarding established scientific understanding of disease mechanisms is also professionally unacceptable. This practice is not only ethically questionable due to the potential for harm and lack of efficacy, but also likely violates regulatory standards that mandate evidence-based practice and professional competence. It undermines the credibility of the profession and can lead to patient exploitation. A third incorrect approach that overlooks potential contraindications or interactions between proposed naturopathic therapies and the patient's existing medical conditions or conventional treatments demonstrates a failure to conduct a comprehensive risk assessment. This can result in adverse events, exacerbation of the disease, or interference with necessary conventional medical care, representing a significant breach of professional responsibility and potentially violating regulatory mandates for patient safety. The professional decision-making process for similar situations should involve a systematic approach. 1. Thorough patient history and physical examination to gather comprehensive information. 2. In-depth understanding of the relevant disease mechanisms and their clinical manifestations. 3. Critical evaluation of available scientific evidence for both diagnostic and therapeutic interventions. 4. Consideration of the patient's individual circumstances, including comorbidities, lifestyle, values, and preferences. 5. Development of a differential diagnosis and a prioritized treatment plan that addresses the underlying disease mechanisms. 6. Clear communication with the patient regarding the diagnosis, treatment options, potential risks and benefits, and expected outcomes. 7. Ongoing monitoring of the patient's response to treatment and adjustment of the plan as needed. 8. Adherence to all applicable legal, ethical, and professional standards. Question 18. The monitoring system demonstrates a patient's serum estradiol levels are within the laboratory's reference range, yet the patient reports persistent symptoms of vaginal dryness and decreased libido. Considering the mechanisms of hormonal action, which of the following interpretations of this data is most consistent with best naturopathic practice? Option A. The estradiol level is within the reference range, but the patient's symptoms may indicate a localized resistance to estrogen's effects at the cellular level, potentially involving receptor sensitivity or downstream signaling pathways. Option B. The estradiol level is within the reference range, suggesting the symptoms are not hormonally mediated and require investigation into other potential causes. Option C. The estradiol level is within the reference range, which definitively rules out any role of estrogen in the patient's current symptomatology. Option D. The estradiol level is within the reference range, implying that the genomic pathway of estrogen action is functioning adequately, and the symptoms are likely due to other factors. The correct answer is B. The estradiol level is within the reference range, suggesting the symptoms are not hormonally mediated and require investigation into other potential causes. Explanation: the monitoring system demonstrates a patient's fluctuating hormone levels, presenting a common clinical challenge for naturopathic physicians. The challenge lies in interpreting these dynamic changes within the context of the patient's overall health, symptoms, and the specific mechanisms of hormonal action, while adhering to NPLEX-aligned scope of practice and evidence-based guidelines. Accurate assessment requires understanding how hormones exert their effects, whether through genomic or non-genomic pathways, and how various factors can influence these processes. The correct approach involves a comprehensive assessment that integrates laboratory data with clinical presentation and patient history. This aligns with the principles of naturopathic medicine, emphasizing individualized care and addressing the root cause of imbalance. Understanding that hormones can act via rapid non-genomic pathways, e.g., through cell membrane receptors affecting intracellular signaling cascades, or slower genomic pathways, e.g., binding to intracellular receptors to alter gene expression, is crucial for developing an effective treatment plan. This approach prioritizes patient safety and therapeutic efficacy by considering the multifaceted nature of hormonal regulation and response. An incorrect approach would be to solely focus on numerical values without considering the physiological context. For instance, assuming a specific hormone level is inherently abnormal without correlating it to the patient's symptoms or the timing of the sample, e.g., diurnal variations, is a failure to apply a holistic and mechanistic understanding. Another incorrect approach is to recommend interventions based on a superficial understanding of hormonal action, such as assuming all hormonal effects are mediated by gene transcription, thereby overlooking rapid signaling pathways that might be more relevant to acute symptoms. This could lead to ineffective or even harmful treatments. A further incorrect approach is to rely on outdated or unsubstantiated theories of hormonal action, failing to adhere to current scientific understanding and evidence-based practice, which is a regulatory and ethical imperative. Professional decision-making in such scenarios requires a systematic process. First, thoroughly review all available data, including laboratory results, patient symptoms, and medical history. Second, apply knowledge of the specific hormones' known mechanisms of action, considering both genomic and non-genomic pathways. Third, correlate the observed hormonal patterns with the patient's clinical picture to identify potential physiological disruptions. Fourth, formulate a differential diagnosis and develop a treatment plan that is individualized, evidence-informed, and within the scope of naturopathic practice, prioritizing the least invasive and most effective interventions. Question 19. The monitoring system demonstrates elevated inflammatory markers and reduced cellular respiration in a specific organ system. Considering the fundamental tissue types and their primary functions, which of the following represents the most likely primary tissue type involved in this observed dysfunction? Option A, epithelial tissue. Option B, muscle tissue. Option C, nervous tissue. Option D, connective tissue. The correct answer is D, connective tissue. Explanation. The scenario presents a challenge for a naturopathic physician in interpreting physiological data that may indicate underlying tissue dysfunction. The professional challenge lies in accurately correlating observed symptoms and monitoring system outputs with specific tissue types and their functions, as defined by the scope of practice for naturopathic physicians within the relevant regulatory framework. This requires a deep understanding of histology and physiology, and the ability to apply this knowledge to clinical presentation. The correct approach represents best professional practice because it directly aligns with the diagnostic and therapeutic responsibilities of a naturopathic physician. By focusing on the primary tissue types and their known functions, the physician can systematically narrow down potential causes of the observed abnormalities. This methodical approach ensures that the diagnostic process is grounded in established scientific principles and the specific knowledge base expected of a licensed naturopathic physician. It allows for the formulation of a targeted treatment plan that addresses the root cause of the dysfunction, adhering to the principles of naturopathic medicine and regulatory requirements for evidence-based practice. An incorrect approach that overemphasizes a single, less common tissue type without considering broader physiological implications would be a regulatory and ethical failure. It demonstrates a lack of comprehensive understanding of tissue interrelationships and could lead to misdiagnosis and inappropriate treatment, violating the duty of care owed to the patient. Similarly, an approach that relies solely on symptom presentation without correlating it to specific tissue pathology, as indicated by the monitoring system, would be professionally unacceptable. This neglects the scientific basis of diagnosis and could result in superficial treatment that fails to address the underlying disease process, contravening the expectation of competent medical practice. An approach that prioritizes a treatment modality before a thorough understanding of the tissue dysfunction would also be a failure, as it bypasses the essential diagnostic step and could lead to ineffective or harmful interventions. The professional decision-making process for similar situations should involve a systematic evaluation of all available data, including patient history, physical examination, and diagnostic test results. This data should then be analyzed through the lens of established physiological and histological knowledge, focusing on the primary tissue types involved in the presenting symptoms. The physician must then consider the functional implications of any observed abnormalities within these tissues and how they might contribute to the patient's overall health status. This analytical framework ensures that diagnostic conclusions are well supported and that treatment plans are appropriately tailored to the individual patient's needs, in accordance with regulatory standards and ethical obligations. Question 20. Research into novel dietary interventions for chronic inflammation has yielded promising preliminary findings from a small, uncontrolled study. A naturopathic physician is considering recommending a specific, unproven supplement based on this research to a patient experiencing persistent inflammatory symptoms. What is the most appropriate course of action for the physician? Option A. Immediately recommend the unproven supplement to the patient, citing the preliminary research as sufficient evidence of its efficacy for chronic inflammation. Option B. Discuss the preliminary research with the patient explaining its limitations, and explore evidence-based, established naturopathic interventions for inflammation, while considering the supplement as a potential adjunct only if further robust evidence emerges and it aligns with the patient's overall treatment plan. Option C. Inform the patient that current scientific evidence is insufficient to support any new dietary interventions for chronic inflammation and focus solely on conventional medical treatments. Option D. Advise the patient that while the research is preliminary, the potential benefits outweigh the risks and proceed with recommending the supplement as a primary treatment. The correct answer is B. Discuss the preliminary research with the patient, explaining its limitations, and explore evidence-based, established naturopathic interventions for inflammation while considering the supplement as a potential adjunct only if further robust evidence emerges and it aligns with the patient's overall treatment plan. Explanation. This scenario presents a professional challenge for a naturopathic physician due to the inherent complexity of inflammation, its multifactorial causes, and the need to integrate evidence-based research with individualized patient care within the NPLEX regulatory framework. The physician must navigate the ethical imperative to provide safe and effective treatment while adhering to the scope of practice and evidence requirements for naturopathic modalities. Careful judgment is required to differentiate between established scientific understanding and emerging, less substantiated research, ensuring patient well-being and professional integrity. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-informed assessment of the patient's inflammatory condition. This involves considering the patient's unique history, lifestyle, and diagnostic findings to identify the root causes of inflammation. It then involves selecting therapeutic interventions that are supported by scientific literature and align with the scope of practice for naturopathic physicians as defined by NPLEX guidelines. This approach ensures that treatment is personalized, safe, and effective, reflecting a commitment to patient-centered care and adherence to professional standards. An incorrect approach that relies solely on anecdotal evidence or unverified research findings would represent a significant regulatory and ethical failure. This would violate the principle of evidence-based practice, which is implicitly and explicitly required for licensed healthcare professionals. Such an approach could lead to ineffective or harmful treatments, failing to meet the standard of care and potentially jeopardizing patient safety. Furthermore, it could be seen as practicing outside the established scope of naturopathic medicine if the unverified modalities are not recognized or approved. Another incorrect approach that focuses exclusively on a single therapeutic modality without a thorough differential diagnosis or consideration of the patient's overall health status would also be professionally unacceptable. This narrow focus risks overlooking underlying conditions, contributing to inflammation or prescribing treatments that are not appropriate for the individual's specific presentation. This demonstrates a lack of comprehensive assessment and can lead to suboptimal outcomes and a failure to address the root cause of the patient's inflammatory issues, thereby not meeting the standard of care expected of a licensed naturopathic physician. The professional decision-making process for similar situations should involve a systematic approach. 1. Thorough patient assessment, including history, physical examination, and relevant diagnostic tests. 2. Identification of potential underlying causes of inflammation. 3. Review of current scientific literature and evidence-based guidelines relevant to the identified causes and potential naturopathic interventions. 4. Consideration of the patient's individual circumstances, preferences, and contraindications. 5. Selection of therapeutic strategies that are safe, effective, within the scope of practice, and supported by evidence. 6. Ongoing monitoring of patient response and adjustment of treatment as needed.